Now, you have heartburn, your chest is burning, your throat feels like someone poured hot tea down it. And so you walk to the fridge, you open the fridge door, and you pour yourself a cold glass of milk. Of course, as you take it, it slides down smoothly. It gives you the cooling and soothing effect that you've been yearning for, and the burning starts to fade away. But here is what nobody tells you about that moment. So within the next 30 to 45 minutes, your heartburn is going to come back, and it is going to be worse than it was before. Now, today, I'm going to show you exactly what is happening inside your body when you drink that milk and why that glass of relief is actually a trap. That is my main objective for today's video. Now, welcome back to the Medical Hub channel. I'm Dr. Libeya. I'm a pharmacist, and my mission is quite simple. My mission is to give you real medical knowledge in simple language so you can make better decisions for your health and also for your family. So if you are new here, please subscribe and hit the bell so you never miss a video. And if you have ever reached for milk during heartburn, which I know most of you have, please stay until the end, because I'm also going to tell you what actually works when it comes to handling your heartburn. Now let's get into the science of all this. First, let's understand why this belief even exists in the first place. The idea that milk cures heartburn is not new. It has been passed down for generations. Your grandmother believed it, her grandmother believed it, and honestly, it makes total sense on the surface, and I'll explain why that is so. So milk is cool and it's also thick. So it feels like it is coating your throat and pushing the acid back down whenever you take it when you have a heartburn. And it is slightly alkaline in nature, meaning it can temporarily neutralize some of the acid sitting in your stomach and also in the esophagus. So when you drink milk, the proteins create a temporary protective layer along your esophagus, acting almost like a shield against the stomach acid below. Now, the temporary relief is real. Milk does help heartburn. I'll repeat that again. Milk does help heartburn, but it only does so for about 20 minutes. So yes, your grandmother was right that milk gives relief. She just did not know what happens next. And that is what we are here for today. Here is where things get really sneaky. The moment milk enters your stomach, your body gets to work, and it gets to work to digest it. And milk, especially whole milk, it contains, number one, fat. It also contains proteins, it contains calcium. Now, all three of these trigger a very specific hormonal response. The proteins and the calcium in milk, they stimulate the release of a hormone called gastrin. Now, gastrin is a hormone that signals your stomach to produce more acid. So you drink milk to stop acid, and your own body, it responds by producing more acid. The rebound typically arrives 20 to 45 minutes after drinking, and it leaves your symptoms worse than before you started. Now, this is what doctors call the rebound acid effect. And most people have no idea it is happening to them. They just think my heartburn is really bad today. But actually, the milk made it worse. Think of it like this. Imagine there is a fire in your kitchen. The kitchen is caught up in fire. So you pour water on it and the flames die down. You feel better about it. But then you find out that the water you used was actually petrol. And in 30 minutes, the fire is going to be bigger than before. That is exactly what milk is doing to your heartburn. Okay? I hope you're following so far. Now, I want to talk about fat, because this is a second reason whole milk makes heartburn Worse. So at the bottom of your food pipe, that is your esophagus, there is a muscle called the lower esophageal sphincter, or LES, as is commonly abbreviated. And think of the LES as a door. So when it is strong and closed, acid stays in your stomach where it belongs. When it relaxes and opens, acid splashes into your esophagus. That burning sensation that you feel, that is acid touching the lining of your food pipe or the lining of your esophagus. Now, dietary fats, they signal the esophageal sphincter to physically relax. And when it does so, it causes its pressure to drop significantly. Now, a weakened sphincter is the direct mechanical cause of what we call gastric esophageal reflux disease, or abbreviated as GERD. Now, whole milk's fat content, it relaxes the lower esophageal sphincter within 2 to 3 hours. And when this happens, it triggers rebound acid production. And this happens despite the initial temporary relief that it provides, or the whole milk provides. So whole milk is doing two dangerous things at the same time. Number one, it is triggering your stomach to produce more acid via gastrin pathway that I mentioned, and also it is opening the door, that is the LES, so that acid can freely travel up into your food pipe. And the result, more acid, an open pathway, and a burning chest that feels twice as bad as before. Now, I know that some of you are thinking, Doc, what if I drink low-fat milk or skim milk? Isn't that better? The answer is slightly, it could be better, but not by much. Now, low-fat milk empties from the stomach faster than whole milk, reducing the LES relaxation time. However, the calcium in milk and the acid rebound effect still applies. The fat-related delay is just reduced, making low-fat milk the least harmful dairy option that you could have. So skim milk is better than whole milk for heartburn, but it still triggers rebound acid. The calcium is still in there. The gastrin response still happens. You're still stepping into the same trap, just with slightly smaller consequences. Now, here in Africa, something interesting that you may need to take note of. Here in Africa, there is another layer to this conversation that most people do not think about. Now, a significant number of us are lactose intolerant. A significant number of us. And this means our bodies do not produce enough of the enzyme lactase, which is needed to break down lactose, which is a natural sugar that is found in milk. Now, when lactose is not properly digested, it ferments in the gut, and that fermentation produces gas, and that gas increases in pressure inside your abdomen, and that increased pressure is what pushes acid upward into the esophagus. Now, it pushes acid upwards right through that weakened LES door and straight into your esophagus. So if you are lactose intolerant, even mildly, even if you have never been officially diagnosed, drinking milk during heartburn is not just triggering a rebound. It is also causing bloating. It's also causing cramping, it's also causing gas, and even more pressure on your esophagus. What started as heartburn has now become a full digestive disaster, if you may. And all you wanted was some relief from the milk that you took. Now, I want to highlight one specific scenario that is very dangerous. That is drinking milk at night before bed. Now, many people, especially those with nighttime heartburn, they drink a warm glass of milk, that is before sleeping, hoping it will soothe them through the night. Of course, gastroenterologists, they warn patients about drinking dairy before bed specifically because when the patients lie flat, That action of lying flat removes the protective effect of gravity. And when that is removed, it allows the inevitable acid rebound to wash into the esophagus while the patient sleeps. So when you are awake, you swallow regularly, and saliva washes acid back down your esophagus naturally. But when you are asleep, that protective mechanism, it switches off. Now, the rebound acid that milk triggers when or the rebound acid that milk triggers then sits on the raw lining of your esophagus for hours. And that is how chronic damage of the esophagus begins. Now, you could be saying, okay, no milk, no warm glass before bedtime. I hear you asking, so what can I do? What can I do? That's a question I hear you asking. Now, here are my top evidence-based alternatives that I would like to recommend to you. Number one is unsweetened almond milk. Now, almond milk has naturally alkaline properties that help neutralize acid on contact without the animal proteins that drive massive acid production. Now, it's also low in terms of fat content, which means it empties from the stomach quickly and does not compromise the LES pressure. It also gives you the soothing, coating feeling without the biological punishment that comes with whole milk. Number two, oat milk. Number two is oat milk. Now, oat milk is low in fat and also low in terms of acidity. Now, generally, it is well tolerated by reflux patients. It contains what we call beta-glucan fiber, which can help buffer stomach acid. And this makes it a very good dairy alternative for heartburn. Number three is chewing sugar-free gum after meals. Chewing sugar-free gums after meals. Now, this stimulates saliva production, and saliva is naturally alkaline, and also it helps to wash acid back down your esophagus. Now, simple, cheap, and effective way of doing this or producing the saliva is chewing a sugar-free gum, and just be keen to avoid mint flavored gum because mint actually relaxes your LES. Number four is to elevate your head when you're sleeping. Now, gravity is your best friend against nighttime reflux. Use a wedge pillow or place blocks or books under the head of your bed. Even a few inches will make a huge difference in terms of preventing reflux. Number five is water. Now, when you're talking about water, we're talking about plain room temperature water immediately after heartburn physically washes acid off your esophagus lining. I'll take it once again, water. And by that I mean plain room temperature water. When you take it immediately after heartburn, it physically washes acid off your esophageal lining, and so there'll be no rebound, there'll be no hormonal response, and also just be pure mechanical relief. And if your heartburn is happening more than twice a week, please do not manage it with home remedies alone. That could be what we call gastroesophageal reflux disease, and it needs proper medical evaluation and also treatment. So let's recap what we've learned today. We've learned that milk gives you real relief, but only for 20 minutes. And after that, the calcium and fat in milk, it triggers your stomach to produce more acid than before. The fat relaxes the door between your stomach and your food pipe. And if you are lactose intolerant, you're also adding gas and bloating on top. So the milk is not your friend. It is a 20-minute trap. That is a key lesson that we've learned today. So instead, you need to try almond milk, try oat milk, chew some sugar-free gum, and drink plain water or elevate your head at night. So if this video taught you something new, I would like to request that you please share it with someone else that can help them as well. I guarantee you have a family member or a friend who still keeps milk as their go-to heartburn remedy. Let's change that together. And as you do that, as you share the video, please comment trap below if you have been drinking milk for heartburn. I want to know how many of us have fallen for this. And please remember to subscribe if you're new here, and watch the next video where I will tell you exactly when heartburn stops being a nuisance and starts being a serious warning sign. I'm Dr. Libeya once again, and stay healthy, stay informed. See you in the next video. Bye bye.